Robby, what's on your radar?
Well, at long last, the U.S. federal government will end the COVID-19 vaccine mandates for international travelers, federal workers, Head Start employees, and the healthcare industry. The mandates will expire on May 11th, the date that President Joe Biden has designated as the formal end of the COVID-19 public health emergency. While the Supreme Court previously struck down Biden's mandate requiring 80 million private sector employees get vaccinated, the justices had left intact the mandate for some federal employees and healthcare workers. A vaccine mandate was also still on the books for teachers who participate in Head Start, the federal preschool program, though an earlier court ruling had technically voided that aspect of it. Now, U.S. citizens may return to the country even if they are not vaccinated, but it has been the case that the federal government has continued to prohibit unvaccinated non-citizens from entering the U.S. Most notably, this policy prevented international tennis star Novak Djokovic from participating in the Miami Open. But now these policies, some of the last vestiges of the federal government's emergency pandemic powers, will finally come to an end. On Monday, White House COVID-19 coordinator Ashish Jha made it official, saying, quote, "While I believe that these vaccine mandates had a tremendous beneficial impact, we are now at a point where we think that it makes a lot of sense to pull these requirements down." That's a relief, though it's coming far too late. We did not suddenly arrive at a point where getting rid of vaccine requirements makes sense. In fact, we are well past that point. To the extent there was any justification for COVID-19 vaccine mandates, it rested on the assumption that the vaccines were not merely protective of severe disease and death, but actually prevented the spread of the virus. When public health officials made their case for vaccine requirements, they did so according to the theory that vaccinating a person would substantially reduce the likelihood of person B catching COVID-19. Biden wrongly declared that you're not going to get COVID-19 if you have these vaccinations. Remember that? Let's watch.
One last thing that's really important is we're not in a position where we think that any virus, including the Delta virus, which is much more transmissible and more deadly in terms of unvaccinated people, the various shots that people are getting now cover that. You're okay. You're not going to get COVID if you have these vaccinations.
Biden later tested positive, despite being vaccinated, an experience lots of people have had. Biden, by the way, was hardly the only important person to say that vaccination was going to protect you from COVID. Mandates were intended to, quote, stem the flood of infections, the New York Times reported in September of 2021. But by that time, it was already becoming clear that no societal level of vaccination would eliminate this virus. The vaccines have appreciably reduced the risk of severe infections, particularly among the elderly and other vulnerable groups. But they do not substantially prevent infection itself. The overwhelming majority of Americans have had COVID-19 at least once, whether they were vaccinated or not. The vaccines may reduce the severity of symptoms, and a jab appears to offer temporary protection, much like so-called natural immunity after recovering from the disease. But COVID-19 has proven itself quite capable of evading protection, which is why many people have contracted it multiple times. I'm one of them. The federal government should have left the choice to get vaccinated to the people themselves. At the very least, an expansive vaccine mandate ought to have been debated by legislators, not forced on Americans via a presidential declaration. But Biden declined to recognize these limits on his power and instead attempted to intervene in private medical decisions. So much for my body, my choice. The vaccine mandate was a major violation of individual rights, and the justification for it, a lasting, substantial reduction in transmission, turned out to be seriously flawed. Good riddance to an illiberal policy, and maybe next time the government declares that it just has to seize vast new powers and override individual choice in the name of public health, but it has a really good reason for doing so, we, the American people, will say, show us the evidence, or maybe we'll just say, no thanks. So I have been very upset about these vaccine mandates for a long time. The Biden 80 million private employees mandate was shut down by the Supreme Court. Now this was affecting fewer people, but it was affecting some people. Finally done. The idiocy of that people could come to this country but they couldn't come if they're a foreign citizen unless they're vaccinated, even though like the disease is already here. It doesn't make any sense. You're not keeping it. And if you're vaccinated, which is unfortunately became the case, we wished it was not so, but that doesn't mean you don't have COVID or you can't spread COVID. Like it's not true. It's substantially not true. And yet these policies endured as if it was true.
I think from a public health perspective, this specific policy of like letting people come in only if they are vaccinated would make sense if it was for the term, required to get everyone vaccinated who wanted to be vaccinated, right? If you live in this country and you can't get a vaccine appointment, but people can come from another country who are not vaccinated and potentially infect you, I can see how that would make this policy reasonable. Did they keep it in place for too long? Maybe. I'll concede that, Robby.
They can infect you whether they're vaccinated or not. It's not changing the spread part. It's changing the whether you get really, really sick part, but that's a you thing, not an other people vaccinated thing.
Yeah, and so if you want to protect the people within the system you're responsible for as a public health expert, you might say, well, until everybody has a chance to get it if they want it, we won't let other people come in and potentially infect you. I understand this argument that, okay, the vaccine, many people were saying it was going to potentially prevent you from getting COVID. It ended up preventing people from getting severe cases of COVID, hospitalization, death, all of that. However, as it relates to how severe COVID is, how long you are infected and an infectious person with COVID, those two things are intertwined, right? So if you are vaccinated and you get a less severe case, aren't you infectious for a shorter period of time?
Sure, which is why I only say it doesn't substantially prevent infection. I'm sure it has some effect on weakening the spread of COVID, but we know this protection doesn't. I don't know how many times you've had COVID or I'm vaccinated. I've been vaccinated. I got the bivalent booster. I've had COVID twice, and my experience is not unique. And in fact, I think virtually everyone I know has had COVID. The overwhelming majority of those people were vaccinated multiple times. It seems like the virus itself. You get it, you're probably not going to get it right away again. It's going to be a couple months, maybe a longer period. That's how it seems to be. But it's just we're not getting to that herd immunity threshold no matter what. Unlike what I think our health experts promised us, that once we get 80%, 90%, we're not there on the vaccination rate, but we're absolutely there on the people got COVID rate. And when you put it together, that's a lot of levels of protection that just are not up to the task of preventing the virus from circulating, just like the flu still circulates and the cold still circulates, and we're not going to get there. So I don't understand the point of the policy anymore.
That's interesting. So you're not coming at this from a standpoint of the vaccines don't work at all. You're coming at this from a standpoint of enough people don't want to take them that will not get to the point of herd immunity.
I think it should be an individual. I'm not going to force it on anyone. I wouldn't make someone lose their job or prevent them from coming to the country or any of that. The idea that right now, I think the only mandates that are truly going to endure are actually for college students, because many colleges are still requiring the bivalent booster. This is one of the least at-risk populations for COVID, and they're going to be the most still required to get vaccinated. Look, it's your choice. Talk about it with your doctor. I think it's a good choice for a whole lot of people. I'm not really against it, but it should be your choice. And to override it being your choice, there would have to be some social, extreme, everybody has to get it, so we're stopping the spread of this entirely, which we're just not meeting that threshold.
It's interesting. Would you say, because you mentioned the university and getting it to be able to do your job, would you want it to be, if you're a business owner, the business owner's decision as to whether or not their employees are required to get vaccinated?
Yeah, I think so.
So then in that case, a person would be required to get vaccinated to keep their job, right?
Well, yeah, you're not, I don't think you're entitled to a job. the person gets to set the, just like if the person says there's a uniform to show up to the job and you want to come shirtless, sorry, you don't you're not entitled to that position. But from the federal government standpoint, as a federal employer, as an employer of tons of people, I think we deserve a say as the taxpayers who fund that kind of expense. And I would not, I don't see what the benefit is to force whatever people are unwilling to get vaccinated. I don't see why we have to bully them into doing that, given that it's not having the social benefit we were promised at the beginning.
Interesting. I like the perspective of, Marianne Williamson, who's been criticized as someone who is anti-vax entirely. But if you listen to her actually talk about the issue instead of reading those headlines, she'll tell you something like, I'm very skeptical that with the lobbying money we see, $375 billion coming from pharmaceuticals and health companies into Congress, that makes it feel weird that some of these biggest pharmaceutical companies are manufacturing these vaccines who have paid many members of Congress a lot of money to say and do God knows what. Then we have these mandates. That is concerning. When you have public health being so irreversibly intertwined with corporate power, that makes me uneasy. And it revisits our earlier point. How do we make people educated enough so that they can take in the research themselves and really make a good decision? How do we teach people in K through 12 education to read these scientific papers that people put out about vaccinations that are not peer reviewed by a board that is also not bought and sold by these pharmaceutical companies? I think that's like really at the heart of this, and we can talk about the federal mandate or not. But at the end of the day, we also have an obligation to make people informed and to give them the opportunity to get informed, to make that decision. And the government's not doing that either.
Indeed. All right, we'll have more Rising right after this.